Our next speaker will be Dr. Bauer. Dr. Bauer is currently the director of the brachial plexus program in the Orthopedic Center at Boston Children's Hospital and an associate professor of orthopedic surgery at Harvard Medical School. After graduating with a degree in chemistry from Princeton University, she attended Columbia's College of Physicians and Surgeons. Dr. Bauer then completed her residency training in orthopedics, followed by fellowship training in hand surgery at the Massachusetts General Hospital. In addition to taking care of infants and children with hand and upper limb conditions, she's actively involved in clinical research, as well as teaching students, residents, and fellows. So, Dr. Bauer, welcome, and thank you so much for coming here tonight to speak with us.
Hi, thanks for having me, Julia.
Yes, of course. So, like I mentioned before, you are an orthopedic surgeon. And so I was just wondering if quickly you could explain how surgical fields are different from medical fields, and why did you choose orthopedic surgery, within all the different types of surgery?
Yeah, that's a great question. So, in academics, many doctors in the medical fields will spend a large portion of their time doing research, whether that's clinical research or bench research. Even at very academic places like Harvard, most surgical subspecialists will spend only about 20% of their time on research and the rest of the, or even less, and the rest of the time on direct clinical care. And depending on the surgical subspecialty that you're in, there'll be more or less time that you're in the clinic or office hours. But then obviously every week has to have time to go to the OR. And so we spend a lot more time doing that than other specialties. So that time has to come from somewhere. And so we spend often less time on research than other other medical specialties.
Okay, thank you so much for your response. So in addition, in the United States, less than 10% of orthopedic surgeons are women. So can you share what your experience is being a female surgeon, especially in an orthopedic field? And what advice would you give to the female audience members who might be interested in a surgical career?
Yeah, gosh, there are more female urologists than there are orthopedists. So you guys need to change that. I think, there's a big part of it that has to do with exposure. So most women who go into orthopedics do so because they had a childhood experience that had them encounter an orthopedic surgeon and know what the field is. I think if you just haven't happened to have that personal experience, when you think of doctors, you just don't think of orthopedists, you don't think of surgery. If you've never had surgery, you don't think about it. So certainly things like this are wonderful. There are programs out there to get even middle schoolers interested in orthopedics and engineering. I would say the other piece of it is that as people go through medical school, there's this perception that that surgery, in particular orthopedic surgery, is not for women. And even I don't consider myself to be that old. I'm 43. But when I was in medical school, I had female doctors tell me that I should not go into orthopedics. Over the Zoom call, you guys can't tell, but I'm 5 feet tall and I weigh 110 pounds. That's not the typical orthopedic surgeon. But I can tell you, I did absolutely everything that was necessary to go through an orthopedic residency. And so you can too. And I think that there's this common misconception that the size matters, and that there are certain things with orthopedics that a woman wouldn't be able to do. And maybe those things were true 50 years ago, but they're just not true now. And, just like what Dr. Meyer was saying, to think about healthcare beyond being a doctor, I always think about the orthopedic nurses. Back in the day, 40, 50 years ago, when every orthopedist was male, most of the nurses who were getting that heavy equipment together and handing it to them and helping the surgeons were all women. And so there's no reason that women can't be part of this, and it's such a fulfilling career. The patient population that we get to work with, the control over your own time, the ability to be a manager and a leader, because every little OR case, the surgeon is the one who's in charge of that room. It's really a wonderful, wonderful experience and a wonderful career. And so hopefully that's something that over the next generation, you guys will change. So you
Yes.
can all take care of me when I need a hip replacement.
Hopefully that will never happen. But thank you so much for sharing your experience and what it's been like for you as a female surgeon. And so I guess when you were maybe in earlier stages of your career, like medical school or maybe early residency, how did you find female mentors in both the general surgical and the orthopedic fields? And how do you think that helped influence, shape, or help your career?
So that brings up a good point because I would say that there's room in your life for all sorts of different mentors. So I just flat out did not have a female mentor until I was in practice, I think. So if I look back at my medical school, there were no female orthopedists at Columbia back when I was in medical school. When I was in residency, there were very few back then. I can think of maybe one that was a little bit influential that, um, was very different than it is now. And so I think, um, I looked for people who were willing to mentor across our differences. And I found really wonderful mentors in the male pediatric orthopedists that were at Columbia. And that led to my interest in pediatric orthopedics and my desire to come to Harvard for residency because of Children's Hospital. And so I think that's something, you can see yourself in all sorts of people, even those that don't look like you. And I think it's also something, I don't know if there are any men on this call, but it also speaks to the importance of, mentors being willing to reach out to those who don't look like them, and also to provide sponsorship and opportunities for people who don't look like them. So my biggest champions were guys when I was in medical school, and that was okay, even though I didn't, we didn't see each other, see ourselves in each other. Maybe I reminded them of their daughter, or they were, just similar personalities, and the relationships worked as mentor mentee, even though we didn't look the same.
And I guess on the other side of that, as part of your professional life, especially with Boston Children's being a teaching hospital, you do a lot of mentoring and teaching yourself. So can you share with us what this looks like and what might you like the most and least?
Yeah, so I think mentoring is a very important part of what we do. I really take pride in being a role model in orthopedics as somebody who maybe doesn't seem like the traditional person. I also have a life, I have a husband, I have two kids, I have hobbies, to show that this is possible to have a fulfilling career and a life. And I think, I don't know if this is what you're getting at, but I don't know. Do you want me to talk about the, what a good mentee would be like? Is that part of your question?
Or in general, I guess in your experience, what is it like to be a teacher as a surgeon, and what is that experience like?
Yeah, so I mean, the hardest thing that we do as academic surgeons is we operate while somebody else is holding the knife, and that's part of our job, is to make sure that the graduates come out being able to do surgery on their own, and never jeopardizing the health or safety of the child under our care. And so I think that's hard. I think it comes from very clear expectations. So at Children's, we have very clear guidelines for teaching in surgery, things that we expect the resident to be prepared for. They have to show us that they're prepared for the case before they're allowed to do anything. We're right there with them and constantly guiding them, but giving them the right amount of autonomy so that they can be successful. And then always feedback and learning, as we're doing the simple parts of the case towards the end, sewing up the skin, putting on the cast, saying, okay, what went well, what didn't go well, what could I do better as a teacher, what could you do better as a learner, so that we're constantly learning in the moment.
Got it. Thank you. And this is a question for you from the Q&A. So Melissa is asking, how much time do you spend on emergency cases versus planned procedures?
So that varies widely within orthopedics. And one of the fun things about orthopedics is that within that field, you can have vastly different subspecialties and lifestyles. So somebody who does say total joint surgery might never do a single emergency case. They might not take any call. They might field phone calls from home if a patient has a question, and that's it. Um, as a hand surgeon at a level 1 trauma center, which is, a designation from the government where the most acute cases go into the ER, I am responsible for cases that might happen in the middle of the night. I would say that's a very small percentage of my practice. The vast majority of things happen during the daylight hours. And then within hand surgery, there's a lot of like semi-urgent things. So next Friday, I have only 2 cases right now on my schedule, and I'm sure that that will be filled with kids who will break their fingers and their forearms and their elbows between now and then. And so, it's not an emergency, but that does take up, I would say, even 15-20% of my personal practice is things that happen like within a week.
Got it. Thank you for sharing your schedule with us. And so now, what advice would you personally give based on your experiences to a high school or a college student who is interested in medicine and potentially a surgical career?
So I think if you're interested in surgery, I think again there's not a lot of like hands-on experience that you can have as a high school student, but as a college student, potentially shadowing, getting to visit the hospital, see what a clinic is like, see what a surgeon's life is like, and then really thinking about your own personality. I would say the biggest difference in surgery is that direct responsibility. So, bad things can happen in the OR, and as the surgeon, you're directly responsible for that patient who's under your care in a way that I think really not other specialties are not like in the moment like that. And so I think having an understanding of whether and that may be hard as a high school student. I don't think I even knew I wanted to be a doctor in your shoes, but as you learn about yourself throughout college, learning what level of responsibility you're comfortable with, I think is very important if you're choosing surgery as a career.
Yeah, thank you. Yeah, that's definitely a large part of being a surgeon, and that's definitely something to consider. And so, similarly, on a similar note, what skills do you think are both necessary and important to succeed at some of the positions you've held or through some of the experiences you've had as a surgeon?
So one of my mentors in medical school told me that he could teach a monkey to operate. And I think that people get hung up on the mechanical skills. And I think that that is something that anybody can learn. So when you're a surgical resident, we will teach you how to operate. I think the skills that you need are more of the softer skills that are harder to teach. So communication, a good bedside manner is all about communication and connection, like Dr. Meyer was talking about, her patients as her partners. We're in this together for a surgery, and you're going to know that person very well. I think those communication skills are very important. And the other thing is the leadership skills. So there's a lot of research that has been done. Atul Gawande writes wonderful stuff. If you guys have read anything that he's written about leadership and surgery, and when that room is a very special place. There's just the people in that room working together on that one patient for however long the case takes, and the surgeon is in charge of that room. And so if you're mean to everybody, it's possible that somebody's going to withhold information. Maybe they have a concern and they're going to be scared to share it. Maybe someone's going to get nervous and not be their best. And so and at the same point, if you're too laissez-faire, like everybody have a great time and blast the music, maybe something that requires more detail and patience is going to get missed. And so that part I think is very hard to teach during a surgical residency, but is probably more critical than your technical skill, is your ability to maintain the focus in that room and get everybody working at their best, because the best outcomes are going to come when your whole team is working at their best.
Yes, thank you. And you mentioned this a little bit earlier, but how would you say you balance your personal and your work life, especially obviously being a surgeon and being a doctor is very time consuming and requires a lot of preparation. So how would you say you kind of manage those two aspects of your life?
I mean, it's always a work in progress. There is no such thing as balance. um, I think one thing that is great about being a surgeon is that you're in charge. So if I have enough notice, I can take any day off that I want. I can, go on a family vacation. I can go to a meeting. I can leave early that day. So my daughter's birthday is coming up on May 1st, and I don't have clinic in the afternoon because we're going to go hang out. Obviously, I knew that was coming up. um, I think it becomes more challenging when the things are close in. So somebody is sick, or there's a random, very important sing along at school that the teachers didn't share with us until the week before. Those things come up, and I think it's important to have a good team at home the way that you do at work, so that other people, if there's something that I can't attend, my husband can attend, or our nanny can attend. And I think that way I'm able to sort of spread myself between work and home. I think it's very important to set boundaries as well. Work will absolutely, fit into any nook and cranny that it can find. And so for me personally, I think Dr. Meyer probably stays at work later than I do. I prefer to get into work super early when my kids are asleep and get all my stuff done, and then come home when it's still daylight out and be able to see them. So I think everybody has their own personal preference and the way it works for them. But the nice part, again, is that I get to decide. So that's something that's not always true in training, but once you get out into practice, you can decide.